about ready? All right. So the next portion of time, I want to talk a little bit about relieving muscle spasms. A lot of people have muscle spasms in a lot of different places. So one technique I learned recently that's helped the most for me is one that's that's online, and it's called Do-It-Yourself Pain Relief by a guy named Gary Crowley. He's a massage therapist. He's trained in Rolfing from Stanford University, very deep massage. I mean, like they put them in soundproof rooms and use their elbow and their knee and just and bruise the patient. And they have to pay up front for 3 treatments because a lot of them bail out after the first treatment. It's so painful. But, and I have another saying when it says no pain, no gain. I have Rolfing is very deep. It's working, you know, it's working those muscle spasms out. It's just really like you might do on a horse or something like that, you know. But we won't do that to poor Maxine here. One of his techniques, he has 3 techniques that he uses. One is just a cross friction kind of deep massage where you pull in and pull back. You kind of press in and pull back. And I use that quite a bit. I like to, again, do my ice massage first when I'm doing a treatment. And then the one that seems to help me the most, though, is finding a stiff muscle, like right there. I don't have to go far to find a stiff muscle. One of her trapezius sides right there. So what's handy is, he says the myofascial release is putting pressure on that muscle. Is it hurting too much? Okay. For 90 seconds. That's what we call myofascial release. Just putting real firm pressure for 90 seconds. A lot of times you'll do 2 hands because your fingers will get tired, or you might use your elbow or your fist, something like that. But one other technique that he uses is interjecting exercise at the same time. So I'm gonna find it on the same one on both sides, so that she can lift her shoulders using that muscle. We'll go ahead and lift both sides. There you go. So that she's now using that trapezius muscle, and we're going to count to 30. So you already have 5, 6, and we'll just keep going, and I'll let you count.
So you're just pressing.
I'm pressing firmly as I would have with the myofascial release, but this seems to stop the spasm faster than just plain myofascial release, and it's a little more effective. I've had patients with shoulder pain, neck pain, back pain, and I'm working on them just in a minute or a minute and a half. It's really relieved it deeply. So okay. And then I just do some deep massage after that. Now, one technique that a lot of people do wrong with these trapezius muscles, they like to pinch. And if you've ever had anybody come up behind you and say, "Hey, does this feel good?" and they just start pinching, and you know, too fast and too deep. And what's better on the neck area is if you'll use your hand palm open and just push down and pull back. And it stretches the muscle, but you're not pinching it that way. It's much more effective. It helps the patient to relax. Much more comfortable. And then you can work up into the neck muscles doing the same kind of thing. Now, one other thing I do when I start getting into the neck muscles, I always support their forehead, because if I'm working up in here and they're pushing back against me, they're not going to relax. So I support the neck and just work those muscles. Do a little round circles. Anybody can do this kind of treatment. Help a friend. You can use your fingertips. If you're using a vibrator, you want to be careful on the neck and around the skull, because it kind of shakes the brain up. It's a little bit strong, unless it's a very gentle little vibrator. But if you've got one of those bigger ones, they work great for the back, for the hip, the legs, the arms. but just when you get too close to the neck, it's a little strong. My preference is a Homedics vibrator that has 2 knobs on it that go back and forth, and I use the rubber tips that have a little bit of a give to it. If you use the ones that are for heat, like the red tips, they're hard plastic, and then they're pounding really, quite vigorously, and they don't have much give to them. But the nice thing about that machine is you've got 2 little things pounding back and forth, but the vibration doesn't get into my hands. Some of the other vibrators looks like a sander, and you're vibrating just as much as it's getting to the patient, and after 10 minutes my hands are numb and I'm tired. So the other kind's got a long handle, and the 2 things are going opposite each other on a little cam, and it's absorbing the vibration pretty much, so I don't get much, and I can push on it. Or a lot of times what I'll do is I'll use that on my back by myself. I'll lay up against the pillow and I'll put it on my low back with that vibrator, and I'll just lean into it, and it really vibrates firmly, but they're quite a strong motor in it, and it doesn't slow it down much at all. Some of them, if you push quite hard, it'll almost stop the machine. This one, since it's oscillating just quite easily, it doesn't stop the machine. So I'm going to work on Maxine for a little while, get her neck to relax. And again, this would be a treatment you would do for a tension headache, just helping those muscles relax. And like I was mentioning before, there are some muscles right along the side of the neck. There's 3 muscles called the scalene muscles, right? Go down here. They do lateral bending and a tiny bit of turning one way or the other, but mostly they do lateral bending. And that's the one that was really tight when I had that tinnitus in my ear, and that ringing in my ear. So Maxine's got a very tight muscles there too. So I'm going to try that 30 repetitions on her for that one too. And she's going to side bend just a little bit, because that's what that muscle does. And I'm going to resist a little, because if on the neck, if I don't resist, so she's pushing against me, now I'm actually engaging that muscle better. If she's only side bending, it's hardly working at all, because unless she was laying down on her side and she had some gravity of her head, the weight of her head lifting up. So I'm just giving her a light amount of resistance, and you're doing 30 reps. The beauty of his treatments is that you can do it yourself. He makes them all so you can do it yourself. He uses 30. Okay. He uses a tennis ball for the pressure. You just have to find something you can push up against. Sometimes you can use your fingers, or you can use some other little implement that you can find a sore muscle, and then you do your 30 repetitions, whatever direction it is that needs to be used to get that muscle going. If it's the biceps, you'll find where it's hurting, and then you'll just flex your arm up and down 30 times. And again, that's another way of easing that muscle spasm to go away. And you can do it anywhere. I had, a second time I pulled a hamstring muscle. I had learned about this guy's treatment, and so I took a tennis ball after about a month and a half, 2 months of letting it heal as pretty much as I could. I didn't want to put the tennis ball right on that area too quick, because I didn't want to make it tear the tissues anymore. I wanted to let it heal as best I could. But it still had a big knot on my ischial tuberosity and the muscle in front of it. I really tore it this time. I was playing tennis and with my son, and I went up and planted, and just as I was planting, I heard this terrible tear, and it dropped me to the ground. I did not know that if you tore a hamstring, it would just, my leg would not function. It would just drop me, and I hit my hip on the ground. And then I was worried about a broken hip, and after about 3 or 4 minutes, I collected myself and my son and his buddies. They go, "Are you all right? Are you all right?" I said, "I think I'll be all right." But so I got up and hobbled back to the house. And the next day we had to travel back to Chattanooga and then get on a plane to go to Maine with 3 stops. So there's 3 airports, dragging our little baggage and stuff. And so it wasn't easy, but I made it. But again, the cold pack on it right away, that helped decrease swelling. And then, so what I did 2 months later is I took a tennis ball and I sat on it right where it was sore. And then I flexed my leg. I think I did it 40 times. I just moved my leg, bending my leg, so I'm using the hamstring while I'm sitting right on that sore spot. When I got up and I tried to move around, I squatted a little bit. The pain had decreased by 50%. The pressure on it, massaging it, just palpating it, it was much less painful. So the next night I did the same thing again, 30, 40 times, and it was about 80% better. Those are the only 2 things I did, those 2 times, and it's pretty well, mostly all gone. I still favor it just a tiny bit. This has been 2.5, 3 years ago. But I just try not to strain that muscle anymore. The first time I was water skiing, and I pushing really hard on that right leg, and it just snapped. The second time was about 2, 3 years later, planting, and it had all gotten better, but I just came up quick, and it really tore that time. All right, so again, for her scalene muscles here, so you did those 30 times, and now I'm just going to do a little cross friction or a little pressure and pull back. Pressure and pull back. So that's all kind of working on those muscles. And it's probably a very sensitive muscle. So it's do you see a expression on her face like it's torture? Or? No, not bad. You have very good control. Does it hurt a lot?
It hurts, but
okay.
It's kind of good hurt. So
a good hurt.
Now I'm wincing like that.
Okay, so that's a little bit, I only dropped down about 1/4 of an inch further, but that's more sensitive right there. So why don't you do that shoulder shrug on the right side again? And I think we can get that one engaged a little bit more there. So we'll do that another 30 times. And while I'm pressing, and when she does the exercise, it actually increases the pain a little bit more because you're using that sore muscle that's got the pressure on it. So it's a little bit of a torture. PT can stand for pain and torture. So a little while ago you said no pain, no gain. There's another one I have that says too much pain down the drain. So I try not to cause too much pain. Sometimes you can actually get a headache going by too much pain, especially around the neck area. So you just be merciful. Don't just tell them, well, you've got to endure this. It's not necessary to kill somebody in order to make them better. And then they'll often people are sore for days after you do that too. One of my friends is a therapist from Australia, and he had just been to a course on how to massage horses or animal massage.
No.
And so he said, well, Byron, let me work on you. And I said, all right. And then he started working on all these shoulder muscles, and I have tight muscles there. I've got a little bit of a kyphosis from vertebrae that are wedge-shaped, and so I have to use my muscles to stay upright all the time. It's not just skeletal that keeps me straight. So he's working down into those rhomboid muscles and the teres muscles, and he was just really killing me. And I said, Bruce, let up a little, man. I'm getting tears here. And he said, oh, you need it. And I said, I know I need it, but let me breathe once in a while, you know. And so when he got all finished, no, it was Bruce. So I stood up and I almost fell over backwards because it had changed my center of gravity. That now I was standing up straighter, and I had to catch myself because my center of gravity usually is forward a little bit, and now I'm upright, and I just about fell backwards. It took me it took me about 2 minutes to kind of recenter myself. Very interesting. So I guess it was a good horse massage, but I needed it. But one other thing that I like to do, and right along the base of the skull, is very helpful for relaxing, again, the tension, headaches. And the way I like to do it is to have 4 fingers on the base of the skull, and I have 4 fingers on the frontal area, just doing opposites. So I'll massage, and maybe I'll start around her eyebrow and just massaging those 4 fingers on opposite sides of the head. That's kind of pressing. So it's her head, she's not using her muscles to stay upright because I'm pressing equal both directions. Then after about 20 or so little circles, then I'm going to come up just slightly on both of them and then work those. And you can do each other if you want to. That's good, but that really is amazing. There's a lot of little trigger points in your forehead especially, and this helps to work some of those. And relaxing if somebody has difficulty sleeping, insomnia, this is kind of a nice treatment to give to somebody that only takes maybe 5 minutes at the most to get them. And I'll usually change about 3 or 4 times. So I'd make little circles with pressure, about 20 or 30 repetitions, and then I'll move up again.
You're moving both hands?
And I'm using both. Yeah, this one, she's got a barrette there, so I can't move up anymore, or
I've barricaded you more.
I'll puncture her skull. All right, so then I'll do the other side, starting again at the eyebrow and the base of the neck there, the base of the skull. And I'm just pressing opposite. And again, if they have chronic headaches, you'll find both of these areas will be puffy. It might be 1/4 of an inch of edema or swelling there. And they might complain, well, that's really tender. And I might leave fingerprints again. Not just on a Korean lady. And for myself, even at night, if I can't fall asleep, or if I've gotten up to go to the bathroom and I can't go back to sleep, sometimes I'll just I'll use my 4 fingers of one hand and just start at my eyebrows right here and just do that to myself, and then move up a little bit and move up a little bit. And or you can use both hands and do the same thing just on the forehead. So it would be pretty much like this. There's little sensitive areas in your eyebrows. And if you see people that have a headache, they're often massaging their forehead around their eyebrows. It's because there's these little sensitive areas. If you work on them, it really somehow relaxes into the brain a little bit. But it helps to put your brain in neutral. If you're thinking about too many things, when you can't go to sleep, then it just kind of puts you into neutral or pushes the clutch in on your motor. And after usually 3 minutes, if you can stop thinking about something for 3 minutes, usually you can go to sleep. So I'll often tell people that have trouble, do this. Also, if you could try and just give your problems to God, just keep praying. When something comes up, you think, well, what about so-and-so? And what about this and that? And I say, well, just, Lord, take care of that problem. I can't deal with it. I need to sleep. And I won't be worth anything tomorrow if I don't sleep right now. So I just give it to God. And if you want to give it back in the morning, give it back. If you want to keep it, keep it. Thank you, Lord. And then you just fall asleep. And if something pops into your head again, say, Lord, take that again. Or something else. I don't need to worry about that now. Just as soon as you stop thinking, you're going to fall asleep.
So you do the 2 things to yourself?
I do just the forehead.
Just the forehead?
Yeah.
And just for a few minutes and you fall asleep?
Just for, maybe 3 or 4 minutes. There's little, you might find a couple little trigger points too. This is another massage technique. If you find one spot particularly, you'll find a little bump there. Like right there, she's got a little bump. So if you do it 4 different directions, north, east, south, and west, I'll get under that little bump and I'll pull it up for 10 seconds. And then after 10 seconds, then I'll get above that little bump and I'll push down 10 seconds. And then I'll go to the side of that little bump and I'll push it going east now. And 10 seconds. You will be amazed how that affects the circulation in your brain, and just with one of those little painful spots. There may be 4 or 5 of them. Now I'm going to go and push it a little bit west or to the right.
I'm getting sleepy.
Oh, it's already working.
Is that bump there because of the tension, or is that?
It could be. I don't know what the little bumps are there, but there are little painful spots. It might be the end of a nerve, a little, a little inflammation there or something. But you've got just definitely you can feel on your own forehead. You just right there. I can feel a little spot that is very tender, and so I'll push down for 10 seconds, push up for 10 seconds, right and left for 10 seconds, and you'll find that to kind of help relax you, just make you feel a lot better. Okay, now I'm going to show you one of the techniques sitting up, and then we'll do it laying down. This is for the headache that's got the tension headache. You want to do a little neck traction. And so I'm going to hold her forehead, and then I'm going to lift her. I'm going to get under her occiput here, right where the neck attaches to the skull. And I'm going to lift up just gently. Don't pinch too hard there. You want to just mostly lift. And I can go just straight up, and I'm kind of supporting my arm against my pelvis so I can lift without using my biceps too much. And then the one that really helps with the headaches, there's this vertebrae, your very top vertebrae. Sometimes it's misaligned, so I'm going to, while I'm lifting, I'm going to tip her head sideways a little bit to one side and then the other. And while I do that, I'm pushing, when she's this way, I'm pushing on that vertebrae underneath, up inside there. Now you'll see my thumb, when I go this way, I can push that vertebrae. There's a transverse process on the vertebrae, and I'm pushing that just a little bit that way and then a little bit this way. And on people that have stiff necks, if you feel it not giving, that's probably the problem. It should have a little softness to it. It should give just a little bit. And don't go too fast. Just maybe 3, 4, 5 seconds to one side and 5 seconds to the other side, and just give it a little bit of a push. Are you asleep yet?
That can reset the vertebrae into its
It can. You sometimes you'll feel it click a little bit. It'll actually realign itself. More likely when she's laying down that I would get it, because I can traction a little better with her laying down. So if you would go ahead and we'll move this down a little bit. Yeah, okay. Now I'm going to sit down because this is, yeah, right on the edge is good. That's good. You can take your glasses off so you're not a teacher anymore. Now, I'm going to just show you, when I first see a patient, the first thing I do is I analyze their neck vertebrae. I'm going to be pushing with my fingers here and my fingers here going up and down, just back and forth. Well, actually with my index finger and my ring finger up and down this way. What I'm doing is I'm trying to see how much play there is between each vertebrae. So a lot of times there'll be one that's sticking out. It should just it should go smoothly. Each vertebrae, I'm going to move up, start at C7. C7 is the one that sticks out the most. If she was to bend her head forward, you'd find one vertebrae bumps is sticking out there the most, and that's C7. Then I'm going to just kind of hold her neck, and I'm going to lift up the neck with my right hand, and the left hand is going to stop the vertebrae below it from moving down with her neck. So I'm raising past it, and now I'm pulling it back down just a little bit, and it's gliding one vertebrae on another. You follow what I'm doing? So this one's holding firm, and I'm lifting it up past, and then I'm coming down, but I'm holding this, and I'm kind of pushing down just a little bit to see if that upper vertebrae can go down slightly. So there's maybe a quarter of an inch to a half an inch of movement between those vertebrae. And it's probably only, probably a quarter inch. But one time in Bangkok, years ago, I was doing this. The doctor had ordered neck traction, so I wanted to see, how her neck was. She had chronic headaches. And so I'm doing this, and all of a sudden, instead of a quarter inch of movement, there is a half an inch or 3/4 of an inch of movement. And I went,
It increased all of a sudden?
yeah, around C3, all of a sudden it just went, shoo, and it went, shoo. She said, "Oh, that hurts." I said, "Okay." So I called the doctor, and I said, you need to x-ray this lady's neck. Something's not right about it, because it's hypermobile. There's some malformation, or something's wrong in that neck, because it's not supposed to, something's torn or something. It's not supposed to go a bunch. So he x-rayed her, and he called me back and said, "Thank you so much for not doing traction on that lady." Said she has a malformation in her vertebrae where there's no transverse process on one vertebrae, so there was nothing resting and holding it together on one vertebrae, and it was just moving on itself. If she had gotten in a car accident, her head probably would have fallen off. I mean, it might have severed if it was a bad rear end accident. So I was grateful. So I always try to assess. Probably only one in a couple million that would have that. Maybe only the one in all of Thailand. Probably it was an Indian lady. But so anyway, I worked on her, got her muscles toned up, and I strengthened the muscles so that the muscles are doing more work, and then just got the muscles to relax, the tight muscles, and she did improve. But I didn't do the neck traction on her. That was, that could have separated the whole spine by doing the traction. So your ligaments hold everything together, bone to bone, and if she didn't have the bone stuck to the ligaments, it just allowed way abnormal movements. Okay, so I'm working my way up. Everything feels normal. When I get like right about in here, sometimes it'll just feel like there's a bump there, and the next vertebrae is not gliding. Then I know that I probably am going to, and usually at about C3, C4, they'll have pain down one shoulder, scapular pain, and I'm thinking this one's probably going to have a little manipulation to the neck on that one. So what I would do is I just finish doing these gentle stretches up and down. I've got my middle finger here holding it, and I'm just and this you can do just gently. It doesn't have to be a therapist. You can just to do this much here, okay? But nobody really knows too much, not too many people do this, but it's just a very relaxing treatment for somebody that has stiffness in their neck. Then I'll turn their head just slightly, put my thumbs, the transverse processes are on the side here, put my thumb and my index and my middle finger there, hold her chin, and I'm just going to tip her head just slightly, cradle her head, and just move it up and down slightly. And now I'm going to put a little traction on the neck and just continue to do that. This is the layman way of doing popping it. It will often realign just doing this. And that's all I'm going to show you. Just tip the head about 40 degrees, 35, 40 degrees, and just tip very gently. So I'm lifting with my forearm against her forehead and then letting it go back. But I'm kind of holding here, pushing down just slightly on that transverse process with a little traction.
Yeah, it's stuck.
You feel it sticking there?
Right there, yeah.
You feel it needs to do something there?
Mm-hmm.
All right. But it'll often it'll loosen it up.
That's better. Yeah, that's better.
And usually it'll feel like, oh, that's almost going to pop. I can feel that. And sometimes, it'll be helpful just to turn the head with a little traction. And then I'm going to go to the other side now and do the same thing over here. So again, I'm going to cradle, hold her chin, cradle against my arm, traction a little bit, starting about C7 and then up and down just slightly. This is trying to regain the lateral bend that a lot of times is stiff. And I'm moving up again. Still I'm pulling just gently. Now be careful, you keep your little finger up. Be sure you're just pulling on the chin and not the Adam's apple or the Eve's apple. And just working your way up. About 6 or 8, 10 times each vertebrae. And if it's sticking, you might do a little extra, maybe 20 or 30 times. And I might kind of really hold it there and pull down just a little extra, just to give it a little extra tension there while I'm tractioning. And then the top one again. Okay? How's that feel?
That feels okay. I'm still, this side is still very uncomfortable, but it's been a year since I've had that
Yeah.
out, so.
Okay, now I'm going to just do the top vertebrae, just the same as we were doing earlier. I've got my thumb right on that top transverse process, and I'm just kind of pushing down on it just while I'm tractioning, just a little bit there. And then I'll do it the other side. So my thumb's doing the pushing on this one. I traction it and push. You'll feel the bone right there at the base of her skull.
Like pushing like that against your.
Yeah.
You feel that bone pushing.
My thumb's pushing. If you can think of trying to move that bone just slightly down, that's what I'm doing. And it should feel like there's some little bit of give to it. If it's just resisting and it doesn't give at all, there's some problem there, and then I'll spend more time working on that. And then if she says she has some stiffness on this right side, I'll usually, and this is where you might want to take it to a chiropractor or a therapist. So I would turn their head as far as it goes comfortably, give it a little traction, and just gently. You don't have to snap it and make it real painful, but just lightly, and just move it just a little quick. Doesn't need to go too far too fast. And usually if it's on the right side, it'll pop going to the left, and if it's on the left, it'll pop going the other side. So just a little traction and just a little tiny quick movement. I'm going to do it just a little firmer going the other way this time. Okay.
I don't feel like my bone. It's my muscle. The muscles really are.
So the muscles are just more tight than the vertebrae.
Yeah.
So we can just work again deep in these muscles here, and then more on the right side than the left. So
Right there.
it's good you came to my office today.
I went to a chiropractor last summer. I was in England. It didn't help.
It didn't.
No.
Okay.
Right there.
Yeah. So again, she's got this scalene and it's not the trapezius, it's more the scalenes. But so go ahead and lift your shoulder again. Or actually, let's see if you tip your head sideways, if that engages it better. Yeah, a little better. That's good. We'll do that 30 more times and see if that doesn't help. It doesn't feel as tight as it did a little while ago. Okay. Now shrug your shoulder 30 times. Yeah. I can tell that's hurting. She's got a furrowed brow here. Right? Bless your heart. She's counting.
That's 30.
Okay. It's hard as a rock. It feels like, my wife's got some muscles that feel like bones. It should feel soft there, and it's like a bone. These muscles often in the neck, they've been hard for years and years, so you don't think you're going to get it to let go in just one treatment. And there again would be some good spot for ice massage to that area. All right. So that's one thing I would do for the neck. Now we can talk about some low back issues. The low back, if you think of your vertebrae, each vertebrae has a disc in between it. And the disc, if you think of it like a Oreo cookie, it's got a sandwich to cream. If you squeeze the cream on one side, the cream's going to push out towards the spinal cord. So you want to do it the other way. So used to be we do these Williams flexion exercises to help low back pain, where we bring the knees up to the chest and hold them. That would stretch the muscle, but at the same time it would push the disc the wrong direction. It would be pushing towards the spinal cord, and it caused more problems of herniation. So we quit doing Williams flexion exercises. Now we do more extension exercises. That's where you're arching your low back. You get on your stomach, you get up on your elbows. So why don't you show them on the stomach, doing a little back extension exercise.
I used to study my Sabbath school lesson on my elbows.
Now, first thing in the morning, somebody that's got a problem like this with the low back, if they'll pray for 2 or 3 minutes, studying a Sabbath school lesson, you might end up with a bed sore there. It depends how long you study on your elbows. But the elbows do get a little tired, so you have to take a little break. But this is just stretching, so it's pushing the cream away from her spinal cord, away from some impingement of a nerve. The nerves come out of the spine and go down the legs in the low back. So if you can get that early in the morning to push the cream the other direction, then that helps to relieve it for much of the day. At least better.
If I need to, I'll just
yeah,
do a little extra.
she's very flexible. A lot of people can't raise up that far, but that's good. Now, one other exercise we have is the Superman exercise. That strengthens the shoulder and the low back and the leg at the same time. So lie down all the way, and then we're going to have her put one arm out and lift this arm and the opposite leg up. So we do an up and down, and do that 5 times on one side. And she can actually lift her head a little bit while she's doing this lift also. Okay, and then 5 on the other side. So that's working all those low back muscles, working your hip muscles, working your shoulder muscles. While you exercise the muscle, it helps to keep from getting muscle spasms. So do 5 there and then 5 back the other way here. And she can support herself here with this other arm. That's fine. Okay, and then 5 back on this side again. Good. Now after lunch, I'm going to show you guys another exercise that I came up with for the low back, and we'll see if we can find a good place to do that one. One other thing that will help, go ahead and lie down again, for a low back is bend both knees, and now let your legs rock to the left and then rock to the right. That one, she's got tight quadriceps muscles right now, and that's rocking, that's turning her pelvis and stretching her low back, but it's giving it nice range of motion. You'll be surprised how that feels. Quite interesting, quite surprising. And it works to your SI joint?
Yes, and this SI joint
Doesn't like it.
Yeah, this one doesn't like it. This one
Okay.
doesn't like it.
Well, we'll work that one in just a little bit. Let's see what time we got. Oh, it's only 12:09. We can do it now. Is that one you've done before? No? Okay.
I feel like it should have more range of motion.
Yeah, it's not going as far toward the window as you are away from the window. And it's probably that SI joint's kind of got a little bit of a lock.
The tibial band is...
Yeah, okay. All right. So go ahead and stop there. And I think we'll take a 10-minute break, and then we'll do another stretch that will help to loosen up that SI joint.
Okay. I got flaxseed oil in my hair, so you just
Yeah.
flaxseed oil everywhere.